Okay, so what we have, first of all, I'm going to walk you through the parts on the external side of the heart. We have the anterior view here, posterior view here. Easiest thing to identify about the posterior view is you can see a lot of these special blood vessels. On the anterior side, you can see some of those blood vessels. Again, we'll walk you through some of those blood vessels in just a little bit. You can see the auricles, and then you can see the two parts of the ventricles, or the two chambers that we call the ventricles. Here on this side is the left ventricle, which forms the apex of the heart, the apex being the point of the heart, and then the right ventricle on the other side. Those are separated by this depression, which we call the anterior interventricular sulcus. We call it the anterior interventricular sulcus. It's on the anterior side, and interventricular means it's between the ventricles. Sulcus means that it's a depression. So if we know that this is the left side of the heart, that would make this the left auricle. This would be the right auricle. Okay. And then if we kind of follow around on the back side of the heart, you'll notice that there's another depression. Okay, this depression here is the coronary sulcus. It circles all the way around the heart between the atria and the ventricles. Okay, kind of just underneath the auricles. So on the back side of the heart, you can see the coronary sulcus. In the coronary sulcus is this major blood vessel, the coronary sinus, which drains blood from the coronary arteries and drains it back into the right atrium. On the backside, you'll also find the posterior interventricular sulcus, which is the depression that divides the right and left ventricles, just like the anterior interventricular sulcus. Okay. Now, if I pop the top off, the anterior part of the heart, I should say, we now have exposed the four chambers. Okay, so I'm going to work on the right side here with this chamber, which is the right atrium. Right atrium receives blood from the superior vena cava and then the inferior vena cava. So you can see those pretty well from the back side. Inferior vena cava, superior vena cava. Okay. Now, dividing the right ventricle, or the right atrium from the right ventricle, is the tricuspid valve, or we also call it the right AV valve, right atrioventricular valve. Okay. Attached to the AV valves are the little cord-like tendons. We call those chordae tendineae, which are going to attach to papillary muscles on the floors of the ventricles. Okay. On the left side of the heart, you'll find the left atrium, where my finger is now, and that is separated from the left ventricle by way of the bicuspid mitral valve, or the left AV valve, which also has that chordae tendineae and is attached to papillary muscles. Dividing the ventricles from one another is the interventricular septum. Okay, don't confuse that with the interventricular sulcus. Septum means wall, whereas sulcus means depression. Okay. If I go back to the right ventricle, this valve here is going to receive blood when the right ventricle pumps, and passes it through this pulmonary valve into the pulmonary trunk. Now, the pulmonary trunk divides to become the pulmonary arteries. And notice how they're colored not red, which most arteries are, because they carry deoxygenated blood. Okay, only arteries in the body that carry deoxygenated blood. Okay, that blood goes to the lungs, where it becomes oxygenated, and then it returns by way of the pulmonary veins, which in this case are colored red, and dump those back into the right atrium. Okay, the left atrium. Left atrium then pumps the blood into the left ventricle, and out from the left ventricle, blood goes through the aortic valve into the aorta. You can see here is the beginning of the aorta, and then there are going to be some branches that aren't super important for the practical on it. There is one final structure to note between the aorta and the pulmonary trunk, which is this little white piece of kind of nothingness. This model isn't the best to show it, but we call that the ligamentum arteriosum, which is a remnant that is left over from the lung bypass, which allows blood to go from the pulmonary trunk directly into the aorta during fetal life, because we're basically not worrying about pumping blood to the lungs. Okay, to make sure I don't forget anything. Oh, on the bottom side of our ventricles, you'll find these kind of internal ridges. Don't confuse those with the papillary muscles. Little ridges are the trabeculate carneae, just to help with blood propulsion. Okay, that should be it.